Welcome to Clinical SAS Training. I provide training in Base SAS, Advanced SAS, Clinical Concepts, and Series Concepts and Programming Concepts, and also provide coaching for the TLFS programming. My email ID is email to clinicalsas@gmail.com. Today I would like to discuss on the SDTM. It is one of the a part of the series. Series is defined as a Clinical Data Interchange Standards Consortium. And SDTM is like a study data tabulation model, and I am going to discuss on 3.2 version. So one of the important first domain is special purpose domains. These special purpose domains contains the subject level data. The first domain in this is comments domain, demographics, and the subjects element subject visits. So this special purpose domains contains only subject level data information. The comments domain, the important domain, and the important variable in this comment domain is a comment. So this comment column accommodates text of a comment, and the length of this comment is 200 characters. If we want to include additional 200 characters, we can create another variable with the name called COVAL1, and if we want to additional variable to create, we can create with this COVAL2. And the structure of this comment domain is one record per comment per subject, and the topic variable in the for the comment domain is comment COVAL. Another domain is demographics domain, which is very important domain in the SDTM, and it contains all essential elements. The variables like RF RF STDTC and RFX RFX ENDTC and RF ENDTC and RFIC-DTC. These are the treatment related date and time variables present in the demographics domain. The age and study day of collection, these are the two numeric variables present in the demographic domains. All dates variables in the SDTM are the character variables, and format is ISO 8601 format. And the demographics domain contains all subjects information who is participated in the clinical study, and the structure is one record per subject, and the topic variable is subject ID. Another domain is subject elements domain. This subject element contains subjects information from the movement of the subjects from one element to another element, and the value of the subjects element start SC provide the chronological order of the actual subjects element. The variable planned order of element present in the subjects element. There should not be any gap between the elements like subjects element start date and end date. The structure of the subjects element is one record per actual element per subject, and the topic variable is element code etc. The another special purpose domain subdivision is subject visit domain. So it consists of all summary of the subject visits presented during the clinical study, and subject visit also contain unplanned visits also should be included in the subject visit. For unplanned visits, subject SVUPDES should be populated with a description. The reason, if the subject is visiting clinical center for due to adverse event, the reason should be populated with for the subject SVUPDES. And visit day is the planned study of the visit, and it should be missing for the unplanned visits. And the structure is one record per subject per actual visit, and the topic variable is visit num for the subject visit. So as of now, we've seen special purpose domains. Now we can see I'm going to discuss on the general observation class. And general observation class is subdivided into three sections like interventions, events, and findings. So general observation class contains all subject level observations collected during the clinical study. And one of the first one is the intervention. This intervention domains contains investigational, therapeutic, and other treatment administration to the subject during the clinical study. And first domain is the concomitant medication, followed by exposure collected and exposure, and substance use and procedures. And first one is the common concomitant medication. It includes the prior medication information also, and it captures the subjects who were taking the concomitant medications during the clinical study along with the protocol specified drug treatment. And the important variables in the concomitant medication are CM pre-specified, CM occur, also called as a pre-specified and occur, and this indicates whether the pre-specified drug like CMTRT subject has taken or not. And the structure for the concomitant medication is one record per record intervention occurrence or constant dosing interval per subject, and the topic variable is CMTRT. And next, another domain in the interventions is the exposure and exposure corrected. So first we'll see exposure. Exposure, it captures the subject's exposure to protocol specified drug treatment or study treatment. And exposure collected, it captures subjects exposure to protocol specified study treatment administered as collected. And the structure is similar, like one record per record intervention occurrence or constant dosing interval per subject for the exposure, and the topic variable is exposure treatment and exposure collected as a treatment for the exposure. Another domain in the intervention is the procedures domain. So it captures subjects therapeutic and diagnostic procedure, the protocol specified pre-specified procedure information to be collected in the procedure domain. The structure of the procedure domain is one record per recorded procedures per occurrence per subject, and the topic variable is procedure treatment, reported name of the procedure. And we have another domain in the intervention that is called substance use. So this substance use during the clinical study, subject may expose or he will take alcohol, coffee related substances. These information also to be collected into the clinical study information. That information we capture in the substance use. So directly, indirectly, this domain helps to assess the efficacy and safety of a drug product. And the structure is one record per substance type per reported occurrence per subject. And topic variable is subject substance use treatment. Another event, another domain in the general observation class, I can call it as a subdivision of the events. Subdivision of the general observation class is events. So event is again subdivided into multiple domains. One is the adverse event, second one is the clinical events, third one is disposition, fourth one is protocol deviations, fifth one is healthcare encounters, and sixth one is medical history. So this events domain contains all events occurred during the clinical studies, and the event might be interested, not interested. So one of the first domain is adverse event. So it captures all the free text during the clinical study which is happened to the subject, and every adverse event should be documented. And the topic variable in the adverse event is AE term, and the reporter and the AE term coded using medical MEDRA. MEDRA is nothing but medical drug regulatory affairs. And MEDRA dictionary is organized by system organ class, and it is subdivided into like high level group term, high level term, preferred term, and low level term. And MEDRA also contains it contains MEDRA standard queries. During the programming, we do consider sometimes for the SMQs based on the study requirement. And the structure of the adverse event is one record per adverse event per subject, and the topic variable is AE term. Next domain is the clinical events. These are the clinical events of interest that would not be classified as a adverse event. The important variables in the clinical events are occurrence and pre-specified. These variables will represent whether the mentioned CM term is occurred or not. And the structure is one record per event per subject, and the topic variable is CE term, reported term for the clinical event. Next one is important domain, the disposition domain in the events domain, which is part of the general observation class, and it consists of all subjects who enter the study will be presented. And it includes the protocol milestones like randomization, informed consent form received, and treatment assignment. It contains different variables with the disposition category, disposition term, DSD code. DS term is nothing but a verbatim term. And the structure is one record for disposition status or protocol milestone per subject. And the topic variable for the disposition is disposition term is reported term for the disposition event. Next domain is the protocol deviation. So there might be chances that subject may not follow as per the protocol or as per the protocol. So that information can be captured in the protocol deviations. So the structure is one record per protocol deviation per subject, and the topic variable is protocol deviation term is nothing but DV term. And we have another domain in the events domain, that is healthcare encounters. It consists of inpatient and outpatient healthcare events related to the subject. And the structure is one record per healthcare encounter per subject. And the topic variable is HO term, reported term for the healthcare encounter. And the next domain is medical history. So medical history, it is a subject's prior history at the start of the trial, means clinical trial. So the values we can see in the medical history are general medical history, gynecological history, or primary diagnosis. The important variables we can see in the medical history are MH pre-specified and MH occurs, and this used to specify whether the MH term pre-specified occurred or not. The structure is one record per medical history event per subject, and the topic variable is MH term. And we have another general observation class subdivision is findings. So in the findings, whatever in the clinical studies we do some tests or perform some questionnaires, the results will be presented in the findings domains. We have a lot of subdivided findings domains present here. The like one of the domain is ECG test results and inclusion exclusion criteria, and some other PK concentration, PK parameters related domain. And the important things we have in the SDTM level efficacy related domains are tumor identification, tumor results, and disease response. So we see the findings domains. One of the important domain is laboratory test results. So we have, it contains the laboratory test results during the screening time and during the visit, during the clinical study. This contains like hematology, chemistry, or urine analysis related data. And we have the lab conversions from the lab original results to standard results. And we have, if you see here, like LBO or RES, original results of the laboratory results, and we can be converted into standard results in character format and numeric format. And we have original results units variable and standard results unit variable, and we have the low level value and high level value variables we have. The structure for the laboratory test results is one record per lab test, per time point, per visit, per subject. And the topic variable is lab test code. And another domain we have in the findings is ECG test results. It is called as EG domain, and it describes the collection of all ECG data, position of the subject, and evaluation method and measurement etc. in the ECG domain. And the topic variable is EG test code, and the structure is one record per ECG observation per time point visit per subject. Vital signs, we have another domain in the findings domain, vital signs, and it consists of all subjects whoever participated in the clinical study, their measurements like blood pressure, temperature, respiratory, height, weight, and BMI, and other details. The structure is similar, like one record per vital signs measurement per time point per visit per subject, and the topic variable is vital signs test code. And we have three efficacy domains present in the findings domain, like that is first one is the tumor identification, second one is tumor results, and third one is the disease response. So tumor identification is this domain contains target and non-target and new tumors information, and the TU-link ID used to link the identified tumors to the tumor response, tumor results domain. And the variables we have like laboratory test results or vital signs results, TU or RES, and TU standard results character. And for the target and non-target and new tumor results, the values we can see. The structure is one record per identified tumor per subject per assessor. The topic variable is TU test code. We have another efficacy domain in the SDTM is tumor results. It represents the quantitative measurements or qualitative assessment of a tumor with respect to target and non-target tumors. And we have the variables like TU or ORRES and TU standard results characters. And usually tumor size will be measured in the numeric values with the mm or centimeters based on the size of the tumor. And we have the TR link ID, TR link group to link the tumor results, and TR domain or TU domain. The structure is one record per tumor measurement assessment per visit per subject per assessor, and the topic variable is TR test code. And another last and third efficacy domain we have in the STTM is disease response, also called as RS response. It represents the response evaluation as per the RESIST criteria we capture in the disease response domain. And the values we can see for the RS original results and standard results as a complete response, partial response, stable disease, or progressive disease. And we have the variables to link other efficacy variables with the RS link ID and RS link group. And the structure is one record per response assessment per visit per subject per assessor. And the topic variable for the disease response is RS test code. And this is the brief description details about the SDTM domain. I provide the clinical SAS training, and I provide for the base, advanced, and also I do interactive sessions, and I provide the project oriented coaching, and I provide like special clinical concept classes students who are coming from the different streamline other than science background, and I will take the classes for the programming for the SDTM and ADAM and TLFS programming. Please reach to my email ID if anyone is interested to take online classes. Thank you.